Welcome to the podcast Above the Cloud, Stories from the Boardroom. In every episode, we interview business leaders who are navigating the complex world of B2B marketing. Whether you're trying to grow revenue, swoop into a new market, or launch new products, we promise you've landed in the right spot. And now your host, Richard Byrd.
Welcome to the podcast. Today, we have a very special guest. We have Chris Turner, the CEO of HealthBook Plus today. So, Chris, welcome to the show.
Awesome, Richard. So happy to be here.
All right. Well, we're happy to have you on. You flew into town for this from Colorado, huh?
Yeah, it's a little warmer here.
Oh, man.
Yeah, it's kind of interesting. Where I live in Montrose, Colorado, this time of year, half the city has Texas license plates. It must have something to do with like 80 degrees versus 103.
Yeah. Well, I grew up here, so I didn't really realize what everybody's talking about when you're like, it's so humid there. I knew it was hot. But I stayed a summer in Colorado, and I had to fly back in August. And as soon as I got out of the plane and got into the concourse, I felt exactly what people were talking about. I was like, yes, this is it. This is the, welcome back home. But yeah, well, Chris, we have a tradition on the show to ask our clients about their spirit bird. So if your company was a bird, what kind of bird would you be?
I love it. The question doesn't have anything to do with your last name, does it?
Maybe a little.
I love it. So what I thought about this question because I think it's a great question. You really kind of, if you do it right, you think a little deep about it. And what I came up with is HealthBook Plus, we're really like an owl, where we help people through the darkness, like owls, they can see at night, or I don't know if they see, or however they function very well at night.
Yeah.
And, people are often lost when it comes to their healthcare journey and what to do. And HealthBook Plus really helps cut through the darkness and gets people to understand what their next best health action is. And then in doing a little research on owls, I found out that in ancient times, they were seen kind of like a Sherpa as a guide. And HealthBook Plus, we really are that Sherpa, that guide to both clinicians as well as consumers along their healthcare journey.
Man, that's a great answer. What a cool bird, too. I mean,
Right?
I think owls are like the coolest.
Isn't it the best thing if you've been walking in the woods and you kind of hear like so,
Yeah.
and you look up and this owl ripped over the top of you. It's just cool.
It is cool. I see them. Even we live in the city, but I'll see them in on our dog walks and everything else. And they're just I love to see them.
Yeah.
When you're out and about. I love the way you described how HealthBook Plus is a Sherpa for patients. Why don't you tell us a little bit about HealthBook Plus and what you guys are all about there?
Yeah, I love it. So we launched in April, and what we do is we help people understand their next best health action. We give clinicians a much better picture of what's going on with their patient population, both at any point of service, whether that's a different health system, their clinic, other clinics, and we combine that with what we call the point of living information. So that's everything that happens outside of the office. And so the way that we do that is we bring into account all of the data that comes from any of your electronic health record information. And then we combine that with like wearable data, smart devices, things like glucose monitors, scales, genetics, daily inputted health metrics, as well as journaling. And we could take all that structured and unstructured data, combine it together, and we put AI on top of it. So we've got an agentic AI system, and her name's Paige. And Paige can help people understand all of that different type of data, whether it's structured or unstructured, and give insights to clinicians and to people.
Wow. That sounds like the perfect application for AI.
It is.
AI is one of those buzzwords that now that everybody's talking about it, and, some people are pretenders and some people really mean it. But, you think about all that structured and unstructured data that goes into it. Think about how much information is in your genetics. Think about all the continuous glucose monitoring, all those data points you have there. Can you imagine having to go through all that as a doctor?
No, even now your watches give so much valuable information, but until now, nobody's been really able to truly interpret it because it's so much information.
Wow. I don't know about you, but my doctor's pretty busy guy. And
Exactly.
It's, I don't know if this is still true, but one data point that I heard was that doctors spend on average of 2 minutes with each patient.
Exactly. And the thing, I don't know if you've been to the doctor lately, but oftentimes, doctors should be having this type of a conversation. But oftentimes they're like this and typing on the computer and trying to talk at the same time, not really paying attention to what's going on with the patient.
Yeah. And I love the name Paige. That's great. It makes everything a lot more approachable. And how does Paige interact with the patient, and how does the doctor get that information?
Yeah, so I'll back up just a little bit since you brought up Paige. Like it kind of came together really interesting. So I think it's a cool story. So we're working with the team trying to come up with a name for Paige, and we are a personalized AI guidance and engagement platform. And someone's like, well, let's just take the letters from that, and it makes Paige with an AI in the middle of it. And I'm like, oh, and it works like Paige in a book. So like the whole thing just came together really cool.
This is a perfect name.
Yeah, I love it. So I'm just so proud of it. The team just did such an amazing job. But what's really great is Paige does phenomenal things for consumers in that she can really help you understand your next health action. So I'll give you an example. I had food poisoning a couple of months ago, which, by the way, I don't recommend for anybody. And,
it's not as fun as everybody says.
No. And all I did was put in my journal, diarrhea, vomiting, fever, had tuna for dinner. And then I looked at my insights version on HealthBook Plus, and Paige came in with, hey, if you really need to see a doctor, don't forget about Teladoc, and that's who we use as a company for telemedicine. So we're always trying to drive people the least expensive, most accessible modality. Mm-hmm. I didn't. I felt okay. But then the next thing Paige told me was, because of your active medical conditions, food poisoning can affect those adversely. You should learn more. So, of course, I clicked on the button and learn more. And Paige said food poisoning from tuna, gave me the scientific name, which I'm not going to try to pronounce. And then down said, here's the typical symptoms, which, of course, I had all of them. Gave me some tips on how to stay hydrated and feel a little bit better. But then she got ultra personalized. And she said, because of these 3 active medical conditions, if these 2 symptoms get worse, then it's time to contact your doctor.
Oh, wow.
And then lastly, here's how you can avoid food poisoning in the future. And I was like, this is so helpful. And I tell that story and show the screenshots to a lot of doctors, and they're like, oftentimes that would have been a phone call to me.
Yeah.
Now Paige can help.
And that's not necessarily what they want to, what time of the day was it the real? Nobody gets food poisoning at 3 o'clock in the afternoon.
No, never, exactly. Yeah, so it'd always be a late night call. But I'll tell you, it's like every day we find something new that she can do. I was talking with a doctor a couple days ago, and she said, hey, Chris, when are you going to put guided breathing into your platform?
Oh, wow.
And I started thinking about that. I'm like, let me ask Paige. Hey, Paige, can you build me a 5-minute guided breathing exercise routine? And in 30 seconds, I had my guided breathing. I'm like,
wow.
Well, she already does it. This is wonderful. So it's like all of these things. I was talking with a guy that works with Kroger. He's like, it'd be really great if Paige could build like recipes and shopping lists. So I asked her, and she nailed it. She said, hey, because you have rheumatoid arthritis, you need an anti-inflammatory diet and a heart-healthy diet because you're over 50. Here's what you should eat for the next 3 days, and here's your shopping list.
Wow.
In a matter of minutes.
Isn't that amazing?
Mm-hmm.
I guess how you structure your data is that, she knows exactly, there's not extraneous data based off of your specific conditions.
Exactly, and I'll just elaborate a little bit more on that. When we pull that electronic health record data, it's super messy. It has a ton of holes, so we have to work with our consumers to fill those holes in. But the other thing we found is at least 65% of our members have data that's inaccurate that comes over from electronic health records. So it kind of makes sense. So health systems built electronic health records for billing. They didn't build them to improve patient care.
Right.
And so often, I don't know if you've ever seen on your bill, like I went in for a simple sinus infection, and now all of a sudden I've got these terms that I don't know, but it's like 3 or 4 levels higher than the sinus infection. Well, that's what gets put in your electronic medical record.
Yeah.
So we encourage all of our members frequently when we get new data in to double check that information. Then we allow them to flag it and say that it's not accurate. So then that way then Paige doesn't pick that up as an accurate instance or medical record.
That is really interesting because I've seen it. There's a lot of human error in those things. Even the automated lab results that come in, I'm like, that seems questionable to me. And it probably is accurate because I think the sensitivity of those machines is accurate, but maybe it's, I wasn't fasting the day I took that, and so my cholesterol's higher than usual because I had bacon for breakfast.
Exactly.
Or whatever it is, And so being able to, customize that data, for accuracy's sake makes a lot of sense.
Yep, exactly. And I was talking earlier about the way the doctors interact. We've enhanced Paige with some other AI technologies like an AI scribe and some workflow tools so that clinicians can put HealthBook Plus seamless into their workflow because oftentimes primary care doctors have about 8 minutes to work with a patient.
Yeah.
And that's just not enough to really get to know folks. So what we've done is we've added these workflow tools that basically the clinician can just, before they see the patient, log into the HealthBook Plus, and Paige will summarize what's happened with that individual since they saw them last. So you immediately get this great picture of what's going on. And then the doctors walk in the room, they hit record on the AI scribe, have a meaningful conversation like this, not their back turned to them typing on a computer. And then when they're done, they hit end. The data gets pushed into the electronic health record from the visit, however form is that the doctor or the clinician wants that to be in. But then what's really cool is a lay version of that gets pushed up into HealthBook Plus. And then Paige now knows what happened at that visit and can keep people on their treatment plans or whatever was discussed there, remind the consumer what should be going on and how they should best take care of their health based upon what that clinician's observations and treatment plan was.
That is amazing. You know what, I'm thinking about the use case for that as like my mother-in-law, she's in her 80s, she's the healthiest person, and even for somebody in her 80s, and she's got memory problems, and she gets stressed when she goes to the doctor on top of that.
Like most people.
Yeah, that's right. She doesn't remember. And even me. I'll come home from the doctor and my wife's like, what'd you guys talk about? And I'm like, I only gave me a prescription. Right.
Well, and just think about it. Like when you're sick and you go to the doctor's office, it's difficult. You're like having a hard time functioning anyways, much less trying to remember all of these complex things that they're talking about.
Yeah. Doctors sometimes can struggle with that. I think they get dinged unnecessarily for their sometimes their bedside practice, but they're busy. They've got a lot to do. They're thinking about the last person and the next person, and the medical system's really, they're trying to optimize their efficiency and
that's right.
Squeeze people through as they can. So it's not always the doctor's fault that it's like that, but having a tool like Paige, I could see where it'd be massive help for both the clinician and the patient. And
that's right.
So then you can go back as the patient and go, this is my use case of, I went to the doctor, my wife, what'd they say? It's like I could go, well, I don't know. Let me go back and look. Oh, you know what?
That's right.
Said no more bacon for breakfast. I probably wouldn't tell my wife that. We'll keep that between me.
We'll
and,
keep that one secret.
Well, that sounds like you guys have built an amazing tool over there. And how long have you been working on it?
So we've been working on it since really early 21. And building it out. And then, like I said, we just launched in April. But I'll tell you, the thing that warms my heart is hearing all of these consumer and patient stories and how Paige has helped them. It just is, it's so just mind-blowing. And it's just like, I'll tell you, it just makes the work that we're doing so much more powerful.
That's got to be rewarding to hear from the patients, that they're, what they're, how it's changed their life. I'm sure that this is the kind of thing that could save people's lives.
Totally. And I mean, even some of our employees, it's great to hear like their stories. And I'll share an example. We've got one employee that's fairly new, and she lost her father a couple days into starting to work with us. And she's been telling us that, Paige has really helped me through a lot of this grief and being able to try to figure out and function every day. And we never thought about, boy, Paige can certainly help with grief as well as, the regular medical type things.
Totally new use case. But if you think about it, if your body is perfectly healthy, but you're depressed, that's going to not make your body perfectly healthy for very long.
For sure.
It's all so interrelated. What an amazing use case that you guys didn't even think about.
No. It's like Etsy. These things just keep popping up. It's just so cool.
Well, it sounds like you guys have built something so really powerful. It's interesting because you've mentioned the consumer, you've mentioned the clinician. Who's your target audience as you go out to sell this and bring it to market?
Yeah, so we've been very laser focused on membership-based clinicians. So that would be things like your concierge docs and your direct pay primary care.
Yep.
And that was our first market we went into. And we did it very purposeful because we haven't built all the gamification and other components into our platform. So we figured patients that are paying $100-ish a month to go have access to the doctor are going to be more engaged in their health.
Yeah.
And therefore be more engaged in the technology that we roll out. And so I'd say that hypothesis worked. We've got really amazing engagement with the platform. And then now we've gradually started to expand out to working with employers and even a couple small payers.
Yeah, you mentioned the payers. I don't think people who are not used to having to sell and market into the healthcare space.
So painful.
Oh my gosh, so many masters to serve, and it's such a complex buying environment. Part of what we talk about on our podcast a lot is complex buying environments. I don't think that there is one more complex than the life sciences space. Because you've got
I totally agree with you.
the person who uses it is different than the person who prescribes it, which is different from the person who's going to pay for it. And they all three are totally misaligned.
Exactly.
And I think also a big challenge that we see is selling to doctors can be challenging.
Well, like you said, they're busy, first
Yeah.
off. Oftentimes, they're not very business-minded. They're very clinical-minded.
Yeah.
So they struggle sometimes with business components. And so, yeah, it's definitely a challenge. But I'll tell you, when they have that aha moment, like, whoa, wait a sec, Paige is going to save me all of this time. Like, this just makes sense.
Yeah, I can imagine that. And I think that was one of the smart things that I was thinking as you were talking about it at the beginning, was that it works into their current workflows.
Correct.
Because okay, I've got this amazing offering that I'm going to give you, and it's going to make you save a ton of money, and it's going to help you be better at your job, but you just have to change the way you work. Conversation's over.
Exactly. But you make a really great point, because most clinicians, that's what they were told when health systems rolled out electronic health records.
Yeah.
Hey, it's going to save you time, it's going to be great, and they were sold a bill of goods. Like I always say, healthcare is the only environment where when you add a new technology, you have to add FTEs. And that's been our history.
Yeah.
But with agentic AI, I think we can make some naysayers and change the tune a little bit with what's been going on in our industry.
What do you say is the biggest obstacle, biggest hurdle for adoption that you guys are seeing out there? These things that are so good and they're almost too good to be true, sometimes can be even harder to sell than things that are where you go, well, there's some trade-offs, I get it.
You're right. And it does so much that people don't understand. So I would say our biggest struggle has been getting the consumer to understand the one thing that they need to do with HealthBook Plus, and similar with the clinician. So if we get a clinician to start working with patients, say, okay, all my diabetic patients, all I'm going to tell them to do is to journal every single day for a week, and then see what the insights come up with. And then if they want to continue journal, great. If they don't, that's okay. Because most people, once they see those insights and how personalized they are, they'll want to continually journal.
Yeah.
But it's really driving down and getting people to find that one nugget that's super personalized for them, so then that they want to use it, because it does so much. That's one of our biggest challenges.
Yeah, I can imagine. It's like it does this and that and this and that.
Yep.
You got to really hone in on the things that really people are going to value the most. But the problem with that is your patients are going to all value
Something
different things. I'm a type 1 diabetic. And so, the things that I would value in that are probably way different than, a friend of mine, she is, you touched on it earlier, a healthcare enthusiast.
Yeah.
She is all about it. Like, she is perfectly, tip-top health, very fit, all these things, but she's got a glucose monitor. And I was like, oh, you're diabetic too? And she's like, no, I'm just curious about what my glucose looks like throughout the day. I'm like, that's so weird.
It's amazing, though, because it really brings the point of personalization. So I'll give you an example. We've got a chief medical officer that is the head of the lifestyle medical board, actually international lifestyle medical board. So she gives all the tests to all of the doctors all across the world on lifestyle medicine as a specialty, so that you can get board certified in it. And then we've got a pediatrician that's on our medical staff too. And they're both pretty similar age. And we stuck a glucose monitor on both of them for a couple months. And the pediatrician, she's Asian, very fit, exercises a ton, but she's borderline diabetic. So the two of them, we go to dinner, they'd have almost the same thing, and look at the glucose monitor, and things are doing much different. So the pediatrician, if she has a glass of wine and then eats, her glucose stays lower.
Yeah.
Our chief medical officer, if she has a glass of wine, it spikes her glucose.
Wow.
This whole concept of having things personalized for you that is going to make the difference in how we practice medicine anymore, because this blanket statement of, hey, you should avoid this, doesn't necessarily compute with every single person.
Sure. We've seen that like forever, right? Remember
For sure.
George Burns,
Yeah.
drank, smoked cigars nonstop, and he was, I don't even know how, he was in his hundreds when he died, right?
Exactly.
And then you get people who do everything right, and you hear about them dying of a heart attack on the jog, and you go, how's this possible? We've been hearing the promise of personalized medicine for a long time. It's been a buzzword. People have been talking about personalized medicine. Can you talk about how you think Paige can really unlock that?
You're right. We've been trying to get to this point, but we've not had the power or the technology to really truly pull that off. And the cool thing with Paige is she does, kind of like my example there with the food poisoning. She teases out the pieces that are personalized to you to really help you focus on your health. And the more data that we have about you, how you're feeling, how you're journaling, your daily health metrics, if we can stick some genetics in there, all of those things make Paige smarter to delivering that personalized guidance.
Yeah.
And then of course it's AI. AI hallucinates. It's not perfect today. So we always want to back that up with a clinician. Sure. Whether that's one of our clinicians that's building out the library for Paige, or whether that's your clinician that you work with every day.
Yeah. Oh, that's definitely something that, we've seen just using large language models, for our work and all that. And sometimes you get something that is far more brilliant than I would have come up with on my own. And then other times you go, this is crazy. This doesn't make any sense. You're hallucinating.
Yeah, I think you made that stat up. It just doesn't seem quite right.
I was like, what was your source for that?
Yeah.
And then it comes back with some BS answer. It's like, well, based on just other, just general things. Okay, that's not gonna cut it. Wow, what an adventure you guys are on there, and how promising all this is. Just transforming medicine and how medicine gets delivered today. And I think that's, you hear about AI and all these things, and there are people who are real pessimists on AI, and there's people who are like the biggest optimists in the world on it. And, it's going to create this whole utopia, and no, it's going to create a dystopian, future and all these things. But when hearing things like this, you go, yeah, that is the kind of thing that is going to create a utopia type environment where people can really thrive and improve people's lives.
Yeah, exactly. And the thing that I think is so special about what we're doing that just really hasn't been done before is everybody says they put the consumer in the middle or the individual in the middle, and they really don't. What we're doing is we're switching that paradigm so that on your phone, you have all of your healthcare information. You've got access to some guidance, and you're the one in control. If you don't want to share some of that information with your clinician, you don't have to.
Yeah.
And that's what I think is really different. We've always built systems for the healthcare hospital systems, for doctors, or for the insurance companies. We've never built something that truly says, let's put the power where it should be, and that's into the consumer's hand.
Yeah, they've tried that before, and like My Chart. I don't want to slag on, anybody that might be a competitor of yours, but it's really pretty useless.
Right. I mean, it is. And the biggest challenge, right? You have My Chart. They give you access to some of your data.
Yeah.
But then it doesn't talk with the other clinics or health systems that you've gone to. I mean, and I'll tell you, like, our data gathering process is really fourfold. We start with bringing information from the National Health Record database, which is called TEFCA or QHIN. So we can pull that stuff on behalf of the patient-doctor relationship, and then we put it in the patient's health book. That oftentimes has holes. So then the next level is the patient can then authenticate through some of our aggregators that we plug into their patient portal credentials, like the My Charts of the world, and then give us access to pull the data from electronic health record and store it for them in HealthBook.
Oh, wow.
Then the third way is we've got some direct integrations into electronic health records. And then lastly, we've got a team that sends faxes out to some of these smaller clinics that don't participate in any of these data gathering processes so that we can truly get that whole health record for the individual. But that's how difficult it is to get most of the information.
Sure.
And then you and I, we aren't spring chickens, so we're come from the age of before electronic health records. I remember when I was 16, I had a knee surgery. So I just added that to my health book. But there's no electronic medical records that have that information.
Yeah. Oh, man. Yeah, I had a lot of emergency room visits that are never recorded. Oh, man. Well, thanks for giving us an overview of HealthBook Plus. It sounds so exciting what you guys are up to over there. Tell me, how'd you wind up being the CEO of HealthBook Plus? Were you when you were talking about your younger days of the knee surgery and all that stuff? Did you think you were going to be the CEO of an AI-driven health information company?
No, what's crazy? I've had a very blessed and fun journey in this thing of life. I started life out as a corporate pilot, so I just figured I'm like flying's my thing. That's what I'm going to be doing, and then I realized that it's pretty boring. So I got into healthcare, and like you spoke about earlier, there's nothing boring about healthcare, boy. There's like all these things you have to navigate, and it's kind of crazy. So, I've had this really blessed journey in life, and it's been really fun. But I'll tell you, like I've done worked with a couple companies like Health Grades, where we grew this little startup from, basically about $7 million in revenue to $250 million in revenue.
Wow.
And then spun it out, and then a couple other digital health companies like that. But I was working for an AI symptom checker company out of Poland, running all of their commercial business. And so we happened to be working with one of our sales guys in Greece, and I met these two guys. One's a shipping owner, another one's a GI doctor. And what they're trying to do is build a solution that had all of a patient's information in the palm of their hand. Because for the shipping guy, his big problem was when a seafarer's out in the middle of the ocean and he's sick, it's really difficult to get him treatment. So I'll dive down a little deeper in that. So for his particular ships, typically the captains are Ukrainian. The seafarers are typically Filipino. So there's automatically a language barrier.
Sure.
And the only information on any of those people on the ship is the pre-boarding physical and the information on the sheet that they filled out before the pre-boarding physical, which oftentimes people aren't particularly accurate so they could get the job.
Sure.
Then when they're in the middle of the ocean, if something happens at seafarer, the seafarer tells the captain sends an email to a doctor on land, the doctor on land sends an email to the captain on how they could treat the seafarer. And you can see where this is going.
Yeah.
They've got all the supplies on the ship, but nobody really knows how to use them or what that health history is there. So the ship gets diverted. Besides costing millions of dollars to divert a ship, it's a big problem for that individual that's sick on there. So what these guys were trying to come up with was a way that these doctors on land would have more information about that individual that's on the boat, or if they do have to divert it, then that individual on the boat can share all their information with the hospital or the clinic that they have to go to.
Wow.
And so then we started talking about, well, what, let's bring this to the States. Let's put some different technologies like predictive analytics, machine learning on top of all this data so that we can really help people understand what to do next. And then LLMs came out.
Yeah.
And our data science team is like, well, we got to switch a little bit and do less machine learning and really more LLMs. And so we've done that, and it's just really made this whole powerful insights journey really fun.
Wow. Man, what an amazing use case for that too.
Right.
Oh my gosh. You don't think about that, but yeah, they're not going to turn that if you turn around your, big marine vessel, to divert to Cyprus whenever you're supposed to go to California.
Yeah.
That's not and wait for, to drop somebody off for a couple of days and try to get into port and all this stuff. That's not exactly a cost-effective solution, but you can't have somebody die on the ship.
Yeah, and I'll tell you, we're really fortunate. Like, the ship owner is an unbelievably caring individual, and for him, it's less about the money, more about doing the right thing and taking care of that seafarer.
Sure.
But the whole thing really combines.
What an amazing story! I couldn't even have thought of that on my own.
It's super cool.
Yeah, but if you could solve for that, you can solve for somebody that needs to just have a more efficient conversation with their doctor.
Right.
On a regular checkup, really scheduled checkup.
Exactly.
So as you know that a lot of our conversations here on the podcast are around sales and marketing and all that, and you've had a lot of sales experience in your career. What would you say is the biggest lesson you've learned about selling in your career?
I'll say I think the biggest lesson is to do the right thing.
Yeah.
If you're that trusted advisor to whoever you're selling to, whether you sell something today or not, it only elevates and snowballs your ability to increase sales and do the right thing.
We call it commission breath, when it's like, what's it going to take to get you into this whatever today?
Yeah, exactly.
You just lost all trust. They're like, this person's in it for them.
Right, exactly. If you're doing the right thing for the person you're trying to help solve some problems with, I'm telling you, like, the sales keep going. And that's been true for our company too. It's like we're way ahead of target, and it's because the sales team's doing the right thing. We're helping to get these doctors to understand how they can improve efficiencies, deliver better care, and become better doctors. And we're not high pressure. If you don't want it, that's cool, because there's someone down the street that's going to.
Yeah.
Like somebody said, AI is never going to replace doctors, but doctors who use AI are going to replace those who don't.
Yeah.
And that docs are starting to realize that. We've got to partner with someone that can really help bring us a suite of AI tools that help drive our efficiencies.
Yeah, and I think one of the great things about doctors is that they love learning.
They do.
and they love information. They love data. Or they wouldn't have made it through medical school, right?
Yep.
That's the weed out. If you're not going to be a learner, you're not going to make it through medical school. And so I think having the tool like this would have to be so powerful for a doctor, as opposed to the things you were talking about earlier, where they promised this is going to really make your life easier, and it made their life way more difficult, and they had to hire 3 people in the front, the building to, manage it and deal with it, and then they had to figure out how to get paid by the insurance company for it. It just seems like such a an answer to what they've been looking for.
Oh, totally. I mean, I'll go off on a little tangent just because it popped in my head, but I remember when I was a kid, I went to the doctor's office, and it was a wife and a husband. The husband was the doctor, the wife ran the front desk, and that was it.
Yeah.
No support staff, and they knew you. And that has just totally changed today, with the exception of direct pay primary care. That's a little bit different, where oftentimes you still do have just that one doctor and maybe a front desk person or a nurse helping.
When I was a kid growing up, I grew up in a small town, and my doctor was also the mayor of my town.
That's great.
Isn't that crazy? Yeah, it's Dr. McKay, and he was like 90 years old, still practicing, and he was the mayor. He was the guy who delivered babies. He had an ingrown toenail, and he cut it off the right way. He just could do everything. He's a super person. It's like I can't imagine that being true in a major city, or just being able to do it. And you're right, his wife worked there.
Yeah.
And his practice was like 2 houses down from his house.
I love it. That's so awesome.
What would you say is the biggest misconception in your industry? And I think probably related to AI, or
I was going to say, you think about like digital health. Oftentimes people are like, oh my gosh, it's another app.
Yeah.
And this thing of app fatigue really is true. Like, I'm not going to get any benefit from interacting with my phone.
Right.
And so then people don't even try. So I think that's one of the biggest hurdles that we end up having to overcome, is to really show like, no, this is unbelievably personalized, because I really feel that the reason why these other digital applications, they're point solutions, so they do one thing like musculoskeletal or diabetes.
Yeah.
They don't really do the whole gamut. But then 2, they're not personalized. Everything's generic. They don't understand the difference between the glucose meter, the pediatrician, versus the lifestyle medicine doctor.
Yeah.
What's really cool about Paige is she does.
Yeah.
She understands those differences and can make things very, very personalized for you.
Yeah. Well, can you imagine how many apps have you downloaded and never used?
Okay, gazillions.
Yeah.
I remember I got a new phone, and all these apps keep coming over. I'm like, what do I do that? What even is that?
I got a message that say, hey, we ran out of space. You're going to have to, buy more space. And I was like, I don't want to pay another $10 a month for space. And then I was like, what is all this up? And it was all these apps. And I'm like, I don't even know what that app's for.
Yeah.
I don't even know I don't even recognize the icon for that. Let's get rid of all this garbage.
Yeah, no, it's so true. And so what we've done in our platform, both on the clinician side and on the consumer side, is we understand that. So we've built what we call our Health Hub Connect, where you can add different applications that you use on a regular basis. That way you only have to log in HealthBook Plus, and then Paige is going to direct you to those particular apps when you need to. So an example, we have a partner called CareSpace AI, and it is super cool technology. It's musculoskeletal technology, where if you hurt yourself or you're not feeling right, you can just set your computer or your phone with the camera, and it'll tell you, have you move a little bit. Okay, move your arm this way, move your leg this way, and you follow the instructions of the AI, and then their AI agent monitors and see exactly how you're moving and can tell when you're not moving right.
Oh, wow.
And then basically boil it down and say, here's most likely what's wrong with you, and then either connect you with a virtual physical therapist or even guide you through exercises to help you alleviate some of the pain or roughness, whatever you've got going on.
That is super cool.
And so what's really great is, so Paige knows you journaled that you hurt your knee. Well, then, hey, let's send you over to CareSpace and have CareSpace be that first point of contact to really understand how bad it might be, and then give you some exercises to help you with it.
I'm thinking about a use case for me. I bought a new generator. It's heavy, and my son and I were taking it off the back of the truck. I pulled a muscle in my lower back.
Yeah.
Like you mentioned, I'm no spring chicken anymore.
Yeah, I'm right there with you.
Lifting up 275-pound generators. But anyway, so I pulled a muscle, and I just happened to be going to the doctor the following Monday. Pulled it on Sunday and went to the doctor. And my doctor, he's a great doctor. I'm not slagging on him or everything, and I told him about it, and he's like, well, you're getting old.
Right.
Stay off of it, put heat, cold. That's it. And so I was like, well, that's okay. So I come home. My wife says, what the doctor? He says, well, I'm old, heat cold. And she's like, ibuprofen. He gave me some muscle relaxers, but the muscle relaxers made me not feel nauseous and groggy the next day. So I was like, well, I'd rather have back pain than not show up at work.
Right.
And so anyway, we did the whole thing, and a tool like that would have been amazing.
Exactly.
I could have started on the stretching. I could have started on all those other things without having to just, be reminded that I'm old.
Yeah, I hear the old thing. A couple months ago, I was working on our tractor. I was changing the oil, and being old, I tore my medial meniscus.
Oh my gosh!
How do you do that changing oil?
Right.
But
you're in Colorado, so I see skiing.
Right.
For sure.
Exactly. I'm like, I gotta get this thing healed.
It's way more fun ways to tear your meniscus.
Yeah, I always hurt myself in stupid ways. I don't know how I inherited that gene, but I did. And but what's crazy about it is being in healthcare. I know that meniscus repair is the number one unnecessary surgery that we do in the United States.
Wow.
But as I'm telling people, like, well, when are you getting surgery? I'm like, I'm not.
Yeah.
And so I'm just doing PT and taking it easy and trying to heal my knee that way versus go get surgery that doesn't really do a whole lot.
Yeah.
And so things like this CareSpace AI, I wish we had that partnership in place when that happened, because that could have really helped me on my journey versus driving down to the PT, hanging out for a couple hours, driving back, those things.
Oh yeah, and just getting an appointment.
Yeah.
Doesn't happen straight away, right? Those
Totally.
guys are busy. Getting the right stretches and exercise and all that stuff early is really important for things like that, I would imagine.
You're absolutely right. And I live in a rural area, and so it's just like my PT is almost an hour away.
Oh my gosh. Yeah, and when we even thought about this for remote areas, and you think about all the health needs in third world countries that it's just impossible to get care for those people, and this could make all that accessible at some point.
It is. One of the projects we're working on right now is Greece has, I don't know what the numbers, but a lot of islands. And oftentimes a lot of them are really small. They don't have medical care. They don't have internet. And so what we're working on is some projects together where we can package Starlink with HealthBook Plus, put it on these islands so that then when these people have an issue, they've got at least some guidance to know like how urgent things are and get some tips to try to treat whatever it is they've got going on.
Wow, that is amazing. What a way to give back in such a meaningful way. When you see I think we get spoiled here in the States, and we think that everywhere is like here, and then you go travel around a little bit and you go, wow, there's so much need for just the things we take for granted here.
Oh, without a doubt. I mean, it's really interesting. My co-founder, he's, like I said, he's a GI doctor, and he's got a summer house in a more rural area of Greece. I think they've only got like 3,000 people in his little town. But when I went there with him, he was like the mayor. Nobody would let us buy dinner. I mean, they're giving him all kinds of stuff because he does all this free medical care for him.
Wow.
When he's there. And, they just don't have access, like the nearest hospital's 4 or 5 hours away, and they just don't have access to great care. And he brings that to them, so they're just so grateful.
We were talking about the other day, like if you had it all do again. When I was in Colorado, I was on a hike and I met these traveling nurses. They go to all the most beautiful places because they need doctors there. Because the best hiking is not in the city, right? It's in the country. And they're like, I was like, what do you guys do? And as you do when you're walking up, I was doing a 14er, and so the guys are like, oh yeah, well, we're traveling nurses, husband, wife, newlyweds. And I was like, wow, that's awesome. And they're like, how long are you here? And we're going to be for 6 months. Where are you going next? We're going up to Montana, and then we're going to go to Alaska. And I was like, oh my God, why didn't I even know this is a thing? If I knew this was a career path, I would have definitely done that.
Oh, it's so cool. So more importantly, what 14er did you climb?
Well, I did 5 while I was there.
Oh, wow.
All easy ones, though. I did like all the easy
There
ones.
is no such thing as an easy 14er.
I did Bierstadt, I did Grays and Torreys, I did Mount Evans, and what's the tallest one? Elbert.
Mount Massive.
Oh, yeah. That's right. Those are the ones I did. It was a lot of fun. It's something, you're not going to beat the views, right?
Oh, no. That's just amazing.
It's such a fun way to do it. I did get lost a couple of times, but the trails seem like they're pretty straightforward. And
They're not.
You're like, why do I wind up on the side of this mountain? I don't think this is where I want to be right now.
Oh yeah, it's funny. I used to always do when I do sales training. There's a mountain just north of Denver that's a 14er. And it's got 2 ways to get to the top of it.
Oh, wow.
One is for normal people like us.
Yeah.
And it takes about 4 hours longer than the straight up version.
Oh, yeah.
But you have to be a climber with ropes and very technical. both those paths get you to the same place. But if you're not an expert, it takes you 4 hours longer to get there.
Yeah. Well, isn't that a great metaphor for life?
Right.
If you're not the expert, take the just slow and steady route.
That's right.
What's the most important lesson you've learned in your career? You've done so much stuff, and now you're leading this amazing organization. What would you say the best lesson you've learned?
What I used to think when it comes to people, I'll give you two. So when it comes to people, I always thought, if hire the best people and then just stay out of their way.
Yeah.
And I've changed my tune in being the CEO and leading an organization. It's really hire really good people, but then have them tell you what they should be doing.
Yeah.
It's a different mindset.
Sure.
But I tell you, by not moving the chess pieces, by letting the chess pieces move themselves, we've been able to accomplish far more. And oftentimes not the smartest guy in the room. And we've got really, really amazing people at HealthBook Plus. And so by having them really drive it and, hey, here's how we should be doing things, conversations, it just immensely improved our performance.
That is amazing advice. It reminds me of a book I'm reading now called Multipliers.
I haven't read it.
Yeah, it's by Liz Wiseman, and that's her whole thing. She said there's two kinds of leaders. There's multipliers, and they get the most of people around them. They challenge them in the right ways. They help them play to their strengths. When they interviewed the people that work for multipliers, they're like, they got 110% out of me. They got 120% of me. You're in the AI business, that's not possible. But they felt that.
Right.
They felt that. And then a diminisher is the opposite. They try to pound square pegs into round holes to fit in their processes. They, people at work, they're turned into these zombies that are like, well, nothing's ever good enough for this person anyway, because I can't do it exactly the way they do it. So I'm just going to try the best I can. And, they get way less productivity. So they never have enough resources. They're always trying to hire more people. Their turnover is bad because people don't want to work for people like that. And,
and it creates that culture of mediocrity.
Yeah.
Which so many companies have.
Yeah. We see it a lot out there, as we consult with people. But man, it's really refreshing. You walk into an environment like you're describing where it's like, wow, everybody's rowing in the same direction. Everybody's contributing their part and growing an organization. And the way you guys are scaling, if you don't have that, you're never going to make it.
Without a doubt. And I'll tell you, the proud papa moments I have is, when the sales team and the customer success team, they're challenging each other, they're pushing each other. I'm just sitting in the background watching. And, it's just so fun to watch. It's like, hey, what are we doing with this account? And one of the other sales guys, well, hey, did you think about this? What are you doing with this? Why haven't you called them back? We're really, truly, everybody in the organization is holding each other accountable. And they feel comfortable doing it.
That is culture.
Seriously brings the tears to my eyes. It's just so amazing to watch.
CEO friend of mine, and he said the best thing you can do is show up to one of your standing meetings you have in your organization. And he says you got to show up and shut up. Don't say anything. Don't solve any problems. Just watch what's happening, and you might be surprised, to do it. And he says you're not doing it right if everybody in the room looks at you and says, "What do we do, boss?"
Yeah, totally. I could not agree more. But I'll tell you, as a CEO that talks a lot, it's sometimes tough to do. But I have to remind myself to zip it. Sit there like they're solving it. Just be quiet.
Oh, man. Well, I resemble that remark. For someone just starting out in a sales or a marketing position, what advice would you give them?
Qualify, and be a good human.
There you go.
That's my advice. I tell you, I've seen it so much where salespeople have a tendency to be an optimist.
Yeah.
Which isn't necessarily a bad quality.
Well, when you get told no all the time, it helps, right?
Right, exactly. But what I've seen over and over and over again is salespeople working on these deals that are never going to close.
Yeah.
They just don't, they've never figured out who the buyer is. They don't have the money to pay for what you've got going on, the power to make the decision. And so, but they keep working it. So what that means is the opportunity cost of spending time with this deal that's never going to close means that you're not bringing in deals that actually could close. So my advice to everybody is just say no often. Say no almost as much as you're getting told no.
That is great advice. I think when I was younger in my career, I think my ICP was like, if they have a heartbeat and they might have money.
Right.
It's like, no. No, young Richard, that is not your ICP.
Yeah. And I'll tell you, though, even like our organization, it's been really difficult because when we started, we thought employers were going to be our sweet spot. So we really started there. And then we realized rather quickly that these HR people are overworked and they don't want to add another technology to their stack, and not a good place to target. And since HealthBook Plus does so many things, we've really kind of struggled with bringing that focus in. And then finally, we just had to put the nail in the coffin, say, nope, membership-based clinicians is where we're focusing. If they lead us to other enterprise deals, awesome, but this is our focus point. And we're just going to need to let some of those other things rest until we really win this stake.
That's right. Beachhead. The beachhead you're going to attack.
That's right.
The way you just said it, it sounds very easy, right?
It's like very true.
Yeah, and then that is one of those things that is far easier say than to really go out and live out and be disciplined about. How'd you manage with your sales team, and how'd you manage it with yourself?
I gotta say, it's really more of a personal management thing than everybody else. Once we laid the foundation, it's pretty easy. But you got these really grandiose things, and we went down the path. Okay, let's talk to some health systems, because I've spent a ton of time working with teams selling into health systems, and I know that the sales cycle's 12 to 18 months, and since COVID, it's even extended further. It's probably 12 to 24 months. And all my friends that are still selling into hospitals are like, it's miserable. Nobody's buying. Nobody has any money. And it's a really tough place. So we started with a couple of smaller hospitals having those conversations, and very quickly realized, like, we're never going to be able to prove ourselves fast enough by going down these enterprise pathways. So we've got to find an area where we can have a really short sales cycle and truly win. And we've been really fortunate. Our sales cycle for membership-based clinicians is about 3 months.
Wow.
But I'll tell
24 months to 3 months, that's pretty
huge, right?
Yeah.
And I'll tell you, it's really cool. I spoke at a conference in February. It was like 150 direct pay nurse practitioners and physician's assistants. Out of those 150 people, we got 15 leads. The sales team closed 14 of those leads in 6 weeks.
Wow. Holy smokes.
I've never been at a company where the sales cycle ramped up that fast to where we got like a really, truly qualified lead and had it closed in 6 weeks.
That is, and that percentage.
90+%.
Yeah. My only suggestion might be you're not charging enough.
Agree.
Says the CEO. I love it.
I say this a lot, and I think my team, it drives them nuts, but don't negotiate against yourself.
Yeah.
So many times, like, we'll get in a huddle. We've got this really important customer. Here's what we're going to do. We can only charge this much, or we can only ask this. And oftentimes I say, stop, guys. We're negotiating against ourselves. Let's ask. We don't know what they're thinking, so let's ask. And then build our plan after we understand where they want to be, and let's meet the consumer or the person purchasing our solution where they're at.
That is such good advice. And I think, we do a lot of pricing with our clients. A lot of our clients sell things that are, they maybe solve $100 million problem. Right?
Yeah.
So you don't want to do that on time and materials, right? And you want to share that value as much as you can. And so we'll go in and we'll start talking to our clients about, well, what does the client really value and all that. And you know who the most price-sensitive people in the room are?
Who?
Salespeople. And you're like, you guys make commission off of the thing. You seem like you would be cheering for this. And they're the ones who lose their minds. They're like, there's no way we could charge that much for that. Forget it. And I think it's because they get told it's too expensive all the time as part of the negotiation. And I think it's a white lie, but it's a lie. Customers don't want to hurt the salespeople's feelings, especially on a consultative sell like you guys are doing. And they were like, well, I'm sorry, you just lost on price. And when we go back and we do, voice of customer research, it's rarely that they lost really on price only, right? I mean, you could certainly blow yourself out of the water and be,
Sure. Another thing Chris always tells everybody is, in the absence of value, price matters.
Yeah.
And so I'm always hammering the team. The reason why we're not winning these deals is they don't understand the value.
Yes.
It's not too expensive. They just don't understand the value.
Yep, for sure. And by the way, if they don't value it at all, it's just not your customer.
And there are bad customers.
Yeah, that's right.
It's crazy though. So many times people like, customer's always right. We got to focus, bend over backwards for these customers. And sometimes we should have never sold that customer because it's not the right fit.
And I think I was talking about it. It's a mistake I made in my career.
All of us have.
When I was starting out, I'm hungry. I gotta feed my family. This is not I never thought about working with these people. They seem kind of like jerks. They're cheap. They've been beating me down on price all the way along. I'm sure it'll be great.
Exactly.
So when you need the money, the deals get more attractive, and when you're starting, and then as you grow, you go, well, that was a huge opportunity loss. That is that was a big waste of my time, and you do gray hair and scar tissue.
That's right.
You learn these things. Oh, well, Chris, this has been a great conversation. What have we not talked about that we should have talked about today?
I'll tell you something pretty exciting for us is, I don't know if you saw a couple weeks ago, the press conference with Kennedy, who's running HHS, and Dr. Oz and the president talking about making health technology great again.
Yeah.
And they're calling it the Federal Health Technology Modernization Initiative. What's really interesting is when you watched everyone on the panel, what they said is what we need to do is we need to be able to make access for patients to get to their data much easier.
Yes.
Put it all in one place on their phone.
Yeah.
Then we need to put AI on top of that and help guide them. So that way then that patient can take their phone, walk into the clinic scans a QR code, they automatically get all of the patient records, and AI can help them summarize what's going on with those records.
That sounds familiar.
Sounds really familiar. So what's really pretty cool is Amy Gleason, who is really running the project, I shot her a text right after that. And like, hey, Amy, we've been in market since April. We've got this. Let's talk. And like 2 seconds later, boom. Yeah, Chris, let's get going. We want to learn a little bit more about this. But it's just
wow.
So many people are seeing now like the power of AI and data in health, and that it's now a federal initiative to bring HealthBook Plus together for everybody. So it's so fun.
It's good to see, we don't get political on the show, but it is interesting when you see that there have been these legacy problems that the government has just not been able to grasp, for a long time. And how long have we been complaining about technology not entering the medical field?
Well, and even in 2020, the Cures Act passed.
Yeah.
And that was supposed to give individual access to data, all your health data. And the thing is, today, if someone says, I want my data as an individual, they get about a 2% return.
Wow.
When we query the networks based upon a treatment use case, so that doctor-patient relationship, we get about 90% of the data back.
Holy smokes.
See, that's just wrong in my opinion.
Yeah.
And not only is it wrong, it's illegal now. But there's nobody enforcing it, so the big players like Epic and others can still just stand and not share the data. We call it data blocking.
See, and that is, who needs that data more than the patient?
Exactly.
Man, well, it's a brave new world. You guys are right in the right product at the right time. So good luck, and I know you guys are going to crush it.
Oh, thanks, Richard. Really appreciate it.
All right, well, thanks for being on, Chris.
Absolutely. This has been fun.
That's a wrap on today's episode. If you enjoyed it, consider subscribing, sharing, or spreading the news about us on your favorite channel. Thank you for tuning into Above the Clouds, Stories from the Boardroom. Until next time, stay above the clouds.